Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today's episode will explore the signs and symptoms that can tell us when to be concerned about a loved one. We will also talk about the first steps you should take when you have a concern about a loved one. So now let's move on to the rest of the show. We are all constantly experiencing change in our lives. As we age, we watch our loved ones age as well. According to the Caregiver Resource Center, every 6 seconds a person in the United States turns 50 years old. The rapidly increasing aging population is creating a care crisis in the United States and all over the world. In fact, the next 4 years, there is expected to be over 2 million people that reach the age of 100. As life expectancy increases, so do the number of families that are taking on responsibilities for aging loved ones. If you are anticipating helping or providing care for a loved one in the future, you may be wondering what signs and symptoms you should be looking for in your loved one, as well as what the aging process generally looks like. According to the Merck Manual of Geriatrics, aging is a process of gradual and spontaneous change, resulting in maturation through childhood, puberty, and young adulthood, and then decline through middle and late age. Healthy aging refers to a process by which deleterious effects are minimized, preserving function until senescence, a productive form of aging leading to organ death, makes continued life impossible. According to the Caregiver Resource Center, studies conducted by the MacArthur Foundation have shed new light on the concept of aging. Findings show only 5.2% of all older persons end up in nursing homes. 89% of persons aged 65 to 74 reported no disability whatsoever. 73% of persons aged 75 to 84 still reported no disability. 25% of persons aged 85 and up reported being fully functional, and 70% of the aging process is controllable. Only 30% is stamped in our genetic code. The last statistic, 70% of the aging process is controllable, is something we should be focusing on when we are younger. Creating healthy habits like eating right and exercising regularly can all lead to longer and healthier lives. Some things are totally out of our control though, like dementia and other diseases. But even so, taking good care of ourselves can help diminish the risks and symptoms of the unavoidable aspects of aging. The Caregiver Resource Center says that everyone experiences aging differently. Some individuals may experience mental and physical limitations that limit their level of functioning, while others will remain relatively high functioning. In looking at the process of aging, it is important to understand the difference between normal aging and that of illness and disease. Usually, people think of aging as beginning around the age of 65, when the changes to the human body actually begin as early as age 30. Research shows that the human body loses about 1% of functioning per year starting at the age of 30. But the human body is able to adapt to the changes unless some form of illness is present. It is important to note that the fundamental changes to a person's physical and mental abilities are a normal part of aging, but disease is not. All too often, an elder is forced to suffer unnecessary pain and discomfort because their doctor or loved one has chalked their aches and pains, incontinence, confusion, or depression up to normal aging, when many of these problems could be reversed or at least medically controlled. During the normal aging process, changes occur to your cardiovascular system, your bones, joints, and muscles, your digestive system, your bladder and urinary tract, your memory and thinking skills, your eyes, ears, and teeth, your skin, and your weight. According to the Mayo Clinic, the most common change is the cardiovascular system, is when stiffening of the blood vessels and arteries, causing your heart to work harder to pump blood through them. The heart muscles change to adjust to the increased workload. Your heart rate at rest will stay about the same, but it won't increase during activities as much as it used to. These changes increase the risk of high blood pressure or hypertension. and other cardiovascular problems. To promote heart health, you should include physical activity in your daily routine. Eat a healthy diet, quit smoking, manage stress, and get enough sleep. With age, bones tend to shrink in size and density, weakening them and making them more susceptible to fracture. You might even become a bit shorter. Muscles generally lose strength, endurance, and flexibility, factors that can affect your coordination, stability, and balance. To promote bone, joint, and muscle health, you should get adequate amounts of calcium and vitamin D. Include physical activity in your daily routine and avoid substance abuse. Age related structural changes in the large intestine, as well as other contributing factors like medications and lack of exercise, can result in more constipation in older adults. Eating a healthy diet, including physical activity in your daily routine, and not ignoring the urge to have a bowel movement can all help prevent constipation with age. The Mayo Clinic also says that your bladder may become less elastic as you age, resulting in the need to urinate more often. Weakening of bladder muscles and pelvic floor muscles may make it difficult for you to empty your bladder completely or cause you to lose bladder control, also known as urinary incontinence. In men, an enlarged or inflamed prostate also can cause difficulty emptying the bladder and incontinence. You can promote bladder and urinary tract health by going to the bathroom regularly, maintaining a healthy weight, not smoking, doing Kegel exercises, and avoiding bladder irritants and constipation. We've discussed at length changes that happen during aging that relate to memory and thinking skills. We recently released a series on the 7 stages of Alzheimer's that discusses the differences between age related memory issues and dementia related memory issues. Visit our website or YouTube channel to find these episodes and more, or listen to them wherever you get your podcast. According to the Mayo Clinic, your brain undergoes changes as you age that may have minor effects on your memory or thinking skills. For example, healthy older adults might forget familiar names or words, or they may find it more difficult to multitask. You can promote cognitive health by taking the following steps, including physical activity in your daily routine, eating a healthy diet, staying mentally active, being social, treating cardiovascular disease, and quitting smoking. Talk to your doctor if you're concerned about any mental changes you may notice. And with age, you might have difficulty focusing on objects that are close up. You might become more sensitive to glare and have trouble adapting to different levels of light. Aging also can affect your eye's lens, causing clouded vision or cataracts. For more information on vision problems and cataracts, listen to our episode on understanding cataracts. Your hearing also might diminish. You might have difficulty hearing high frequencies or following a conversation in a crowded room. To promote eye and ear health, schedule regular checkups and take the necessary precautions to protect your vision and your hearing. Age-related changes also occur to your teeth and gums. The Mayo Clinic says that your gums might pull back from your teeth. Certain medications, such as those that treat allergies, asthma, high blood pressure, and high cholesterol, also can cause dry mouth. As a result, your teeth and gums might become slightly more vulnerable to decay and infection. To promote oral health, schedule regular checkups and brush and floss regularly. With age, your skin thins and becomes less elastic and more fragile, and fatty tissues just below the skin decreases. You may notice that you bruise more easily. Decreased production of natural oils might make your skin drier. Wrinkles, age spots, and small growth called skin tags are more common. To promote healthy skin, be gentle, take precautions, and don't smoke. And lastly, how your body burns calories or metabolism slows down as you age. If you decrease activities as you age but continue to eat the same as usual, you'll gain weight. To maintain a healthy weight, stay active and eat healthily, and watch your portion sizes. Now that we know what the normal signs of aging are and a few ways you can help your body age healthily, let's move on to some of the signs that you are not aging in a normal way. According to the Caregiver Resource Center, depression to the degree that it interferes with usual daily functioning, confusion, delusions, or hallucinations, changes in personality, and changes in basic intelligence are all functions that are not a part of the normal aging process. If you notice any of these things happening to a loved one, it may be time to have a conversation with them about their health and stress the importance of scheduling a doctor's appointment. Go with them to the doctor so that you can express your concerns as well. You know your loved one better than their doctor does. You are able to see more about your loved one's daily behavior than their doctor is able to observe in a 30-minute appointment. Keep a record of the changes and behaviors you notice that concerns you so you can present them to the doctor or other family members. Talk to your loved ones, to other family and friends, and see what others have noticed as well. Most importantly, let your loved one know that they have a support system. Aging can be scary, and your loved one will worry about what will happen to them. Your love and support can make all the difference. We want to say thank you for joining us here today at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate these long-term care issues. We invite you to please visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And please, if you know someone who could benefit from this episode, please share it with them. And remember, you can listen to the show on any of your favorite podcast streaming platforms and watch the show on our YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We look forward to seeing you next time here at All Home Care Matters. Thank you so much.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.